I'm Laverne McGee. It is Monday, January 3rd. Happy first week of the year. New Yorkers having a tough time with COVID surges. New York's Governor Kathy Hochul expects the trend to worsen.
We're not in a good place. I'm going to be really honest with you. This is the winter surge we predicted. We know that particularly after families gathered December 25th over that weekend, another weekend holiday we just completed with New Year's, there's a lot of human interaction. And what happens when humans gather? They spread the virus. And we fully anticipate, on top of the surge that's already been ongoing, that there's going to be another wave that's occurring as a result of these holidays.
On top of that, New York's governor revealed that 51,000, that number is likely an undercount. And that's because a lot of people probably didn't get tested over the weekend, meaning that number could rise dramatically. Meanwhile, Israel reportedly just confirmed its first case of so-called flurona. And that means that a patient has both the flu and COVID. The new year is starting with a massive surge of COVID-19 cases across the U.S. due to the Omicron variant. Some say it's the largest surge since the start of the pandemic, but could this also be the start of the end? BNC correspondent Anser Hassan joins us now live to discuss more about what some medical experts see as significant changes that could come after the surge. Good afternoon, Anser.
Good afternoon, Laverne. Yeah, as more Americans have immunity to the COVID-19, either through vaccination or as a result of being infected, some medical experts say that could be a big part of the fight against COVID-19.
Struggle.
The holidays may be over, but the holiday surge in coronavirus cases is still with us, says Dr. Peter Chin-Hong.
Well, we're in the middle of the surge, and if we look at the playbook of last year, what you see is a stacking phenomenon. There's Thanksgiving, you surge, you can't come all the way down. Then there's Christmas, you surge on top of a surge, you can't come all the way down. And then there's New Year's.
Dr. Chin-Hong is a professor of medicine and infectious disease specialist at UCSF. He predicts come January, Omicron will peak and infection rates should drop. Some medical experts suggest with more Americans vaccinated and others immune after being infected, there could be a period of getting back to normal.
Given a large amount of people having immunity at the same time right now, I think it will give us a reprieve where we might see natural life, life as we know it, pre-2019 come back for a while. Whether or not that will take us through the next variant remains to be seen, and I really hope so.
Dr. Chin-Hong says the best case scenario, COVID-19 will become like the flu and something that emerges in the winter.
We kind of look to see what's happening around the world in their winter, which is like Australia, New Zealand, Argentina, Chile. And then we use that to predict what to focus on for our winter, like we do for influenza.
However, Dr. Chin-Hong points out there are still concerns for communities of color. Lack of access to health care combined with what he calls misinformation about COVID-19 means they still could be at risk.
And it is something that really exposes all the fractures of our healthcare system and will continue to do so until all of us are immunized and have immunity in some way.
Another issue, as rich countries become fully vaccinated, developing nations which haven't had access to vaccines still face risk of surges in new variants, and of course that has global consequences. Reporting live, Anser Hassan for BNC.